So you now have 2 syringes full of lipoaspirate and fat that's ready to be spun in the centrifuge, okay? So before we do anything, put these down. Now remember, we just screwed the little screw back on tight and the caps are on tightly so nothing will come out. So imagine these are now full of fat. So the first thing to prepare is the centrifuge. Now you will need to get your scalp nurse to obviously open the door for you. And on the centrifuge, it's simply a button on the top right-hand corner that says door. Press that and it'll open it. Now to turn the machine on is on the side. There's an on-off switch. Make sure it's turned on. Obviously make sure it's plugged into the wall and that's also turned on. So once the door is open, then these buckets should be in your sterilized trays. Okay, so there's 4 buckets. There's 2 large ones and there are 2 smaller ones. So grab the 2 smaller ones, doesn't matter which side, and the smaller ones go in the rotor numbered 1 and 2, 1 and 2, the space between 1 and 2. You can't get them wrong anyway because you will see in a minute that they are different widths, so they won't fit in any other slot, so you can't get them wrong. So very carefully, without touching anything else, just drop them in. There are little metal parts that stick out and they slot into this slot here, okay? So line them up and then just drop them in. Same as the large one. So hold that, you will see there is a little slot there for it to sit on the little metal feet. So line them up, just drop them in. Only touching the buckets and nothing else. Now on the buckets, there are 2 sides. One has a little engraved number on it, one doesn't. Doesn't matter which side, makes no difference, okay? Most important thing is for you to remain sterile, not to touch anything else. So just drop that in. Now once it's in securely, you grab your 2 FPUs and before you put them in, grab your hex screwdriver and undo the little screw 2 full turns. Now you can either do full turns at the top, 1, 2. Now it should be, you should feel that the little screw is loose, but if you tip it upside down, it doesn't fall out. Okay, so it's loose, but doesn't fall out. So put that into one of the 2 large buckets. So in the 2 large buckets, you will see there are 2 holes. Okay, there are 2 holes. Put one either side, doesn't matter, pick a side, but on the opposite bucket, across the other side, put it on the opposite side, so diagonally. So if you put it on this one, on the other one, you put it in this hole. We'll show you in a minute. So put the bucket back in. All right, so now you've loosened that screw 2 full turns. Okay, hold on to the flange and just drop it in. Now when you drop it in, obviously that syringe will remain sterile whilst it's in the centrifuge. So grab your second one, do the same thing, undo it 2 full turns, okay? So it's loose but doesn't fall out, okay? Now go opposite and diagonal, drop it in to the other one. Okay, so just drop it in, it fits perfectly, and now it's ready. So you ask your scalp nurse, obviously now to close the lid. And then once you close the lid, the setting is always 3,400 RPM or 3,400 revolutions per minute. So always make sure the green light is on RPM and it says 3,400. Now your machine has this in memory already, so it should memorize this setting every time you turn it on. If it doesn't, I'll show you how to reset it again. But it's 3,400 RPM and it's for 5 minutes. Okay, so protocol's 3,400 for 5 minutes. Double check that before you press the start button. And we want to press the soft start. So there's a top button that says soft start, stop, and then a simple start and stop. We want the soft start. So I'm going to, because they are, even though they're not filled with fat, but they should be okay to spin. I'm going to start it. And you can hear and you can see it slowly spinning. So when it reaches 3,400 and 5 minutes, it will then slow down and it will gradually decrease in speed until it comes to a rest. And when it comes to a rest, it will stop and the doors will pop open. So if at any time, and you can hear it's quite quiet, it's very still, it shouldn't shake, if it's perfectly balanced, it will be perfectly smooth and quiet. Now, if at any time it's not, it's moving, it's shaking, you want to stop it, so the same soft start button that you press it again, and it will stop it. Okay, and you can hear now it's winding down, and it will slowly come to a stop. And once it comes to a stop, you'll see the door will automatically pop open. So when the doors automatically pop open, obviously that's when it's finished spinning. So the centrifuge has finished spinning now, and the doors popped open. So obviously ask your scout nurse to open the lid, and now for you to go and just grab each of the syringes. Okay. Now the syringes should now have a bit of oil on top. The piston should sit about there. You will have a layer of fat, and then you'll have your blood and tumescence down the bottom. Okay, so once you've taken these out, just hang on to the flange, pull them out, and of course they are still sterile. So the most important thing, and don't forget once you've got the syringes, is to also tighten the two little screws back again, because we loosened them up before. So just hand tight, tighten them back up again until they're hand tight, and now you're ready to put them down for further processing, transferring of fat, which we will now go through.